How to prepare for an STI test. Preparing for a sexually transmitted infection test can feel overwhelming, but it doesn't have to be. Knowing what to expect can help ease your mind and ensure accurate results. First, it's important to understand the purpose of testing. STI tests screen for infections like chlamydia, gonorrhea, syphilis, HIV, herpes, and hepatitis B and C. Depending on your situation, testing may involve urine samples, blood tests, swabs from different areas, or physical examinations. Next, know which tests you might need. The specific tests vary based on your sexual history, symptoms, and risk factors. For example, nucleic acid amplification tests are often used for chlamydia and gonorrhea due to their high sensitivity. Your healthcare provider will help determine the right tests for you. If a urine test is part of your screening, it's best to avoid urinating for at least 1 hour before the test. This helps ensure that the sample is adequate for detecting infections. When you meet with your healthcare provider, be honest about your sexual history. Sharing details about your sexual behaviors and any symptoms is crucial for selecting the appropriate tests. Providers are trained to handle this information confidentially and without judgment. For women, it's advisable to avoid vaginal douching, spermicides, or vaginal medications for at least 24 hours before testing. These can affect the accuracy of the results. Some tests may allow for self-collection of samples, like vaginal or rectal swabs, which can make the process feel more private and comfortable. Timing is also important. If you suspect recent exposure to an STI, some infections may not be detectable right away. For instance, herpes tests can be falsely negative in early infection, so discussing timing with your healthcare provider is essential. Be prepared for the possibility of a physical examination, as some tests requiring it. Wearing comfortable clothing can make this part easier. It's also vital to understand that testing is confidential, but you should provide informed consent. If you have concerns about privacy, don't hesitate to ask your provider about their policies. Lastly, plan for follow-up care. If your test results are positive, you will need treatment and may need to notify partners. Retesting may also be recommended after treatment to confirm that the infection has been cleared. By following these steps, you can help ensure that your STI testing experience is thorough and as comfortable as possible. Always consult a healthcare professional for personalized advice and to address any questions or concerns about STI testing and your sexual health.